The 2025 national budget, Guyana's largest ever budget, was passed in the National Assembly on Wednesday. This budget was pegged at $1.38 trillion, and it includes key sectoral allocations, helping to advance the government's developmental agenda.
Those in favor say aye. Those against say no. Ayes have it. This concludes our business for today and consideration of the estimates for financial year 2025.
The mammoth budget contains key sectoral allocations from agriculture to healthcare and education. For example, $104.6 billion is for the agricultural sector. $143.2 billion will be spent on advancing the healthcare sector, while $175 billion will be for the education sector. A mega $209.3 billion is for the construction, expansion, and development of roads and bridges all across the country. Now, included in the budget are budgetary measures. These measures include cash grants that will allow funds to be directly disbursed to citizens and tax reforms that will help citizens get more money in their pockets. The 2025 national budget was passed in the House after the consideration of the estimates. Now, this is a process whereby parliamentarians scrutinize the allocations in the budget line by line very meticulously. My colleague Kurt Campbell will now tell you how that transpired early Wednesday morning.
Minister of Health Dr. Frank Anthony defended the health sector's budget, highlighting the tremendous strides made since the government took office. Speaking during the consideration of estimates on Wednesday, Dr. Anthony addressed questions and concerns raised by opposition MPs, including former health ministers Valda Lawrence and Karen Cummings. In the 2025 budget, $2.98 billion has been allocated for the Georgetown Public Hospital. The funds will be used to provide vital facilities, vehicles, furniture, and equipment boosting the hospital's ability to deliver top-tier health care services to the public. One of the major focuses of the 2025 budget is the continued expansion of health facilities. Among the highlights, the completion of the pediatric and maternity hospital at Ogle and the commissioning of 6 regional hospitals in Lima, Dikindren, Diamond, Enmore, Bath, and Number 75 Village. There's also a significant push to expand training and capacity, with $852 million earmarked for new training complexes in Suddy and New Amsterdam, as well as the construction of dormitories for health sciences students.
We previously have not been giving influenza vaccinations in Guyana, but this year we will start by also giving influenza vaccination, and we would give them first to the healthcare workers and to older people in our population. So there are lots of new things that we're doing with our laboratories.
In addition to infrastructure and training, the 2025 budget includes a $28 billion allocation for drugs and medical supplies. This investment will ensure that essential medicines and equipment are readily available, particularly in remote regions of the country. The government also plans to increase the number of vaccination storage units and introduce new outreach methods, such as vaccination boats, to reach communities in the hinterland.
Right now, our system, I would say we're quite prepared to be able to respond to any outbreaks or any epidemics. We have, over the last couple of years, made substantial investments in our laboratories. In the public sector, we have close to 24 laboratories, and we have equipped most of them to be able not just to do rapid tests, but to be able to do PCRs and so forth.
Another key area of focus is human resources. The government has expanded training programs with over 2,000 healthcare professionals already graduated and an additional 3,761 currently in training. In 2025, the Ministry of Health aims to train another 3,290 professionals to meet the growing demand for healthcare services across the country. Dr. Anthony also highlighted the government's commitment to preventative health care, with over 90,000 individuals screened for chronic diseases in 2024 alone. In 2025, that number is expected to rise to 100,000. Mental health services also received attention in the 2025 budget. The government is expanding mental health care across the country, including an 18-bed ward at the Georgetown Public Hospital and the conversion of the New Amsterdam Hospital into a mental health facility. These steps are part of a broader effort to improve mental health care and address the challenges posed by conditions like suicide, depression, and other mental health disorders. For the newsroom, Kurt Campbell.
The parliamentarians then continued this process, scrutinizing the funds for the Ministry of Public Service.
So the exact language of the agreement was 8% salary increase to be paid to public servants for 2025, retroactive to the 1st of January 2025. So whenever it is paid, it will be retroactive to the 1st of January. So public servants will get the full benefit of the increase effective 1st of January 2025.
Now that the 2025 spending plan has been approved in the House, the various government agencies and ministries will be able to execute their work plan for this year. Reporting for the newsroom from the Arthur Chung Conference Center at Liliendal, Georgetown, I am Rishani Ragabir.